This is Crystal Fenn with MedPage Today here in Chicago at the Society of Interventional Radiology meeting, where the controversial vascular theory of multiple sclerosis came under debate. At a press conference here, Dr. Kenneth Mandato of Albany Medical Center presented results on the safety of a procedure to improve venous flow away from the brain and spine for MS patients.
The current medical thinking that we know about is that it's a chronic inflammatory condition characterized by destruction of brain cells in the brain and sometimes in the spinal cord as well. There are 12,000 new cases of MS diagnosed annually just in the United States alone. The most common explanation at the present time is what's considered an autoimmune event where the body's cells attack itself. There are few treatment options available to improve quality of life. Most of them are oral or injectable medications. Medications themselves, as we all know, have risks and side effects. CCSVI, I will say, instead of saying chronic cerebrospinal venous insufficiency over and over again, because it's almost a tongue twister, but CCSVI is a departure from the current MS concept of thinking that I just mentioned. It is the thought that multiple sclerosis patients have blocked veins that drain blood from the brain and the spinal cord. And as you can see in that image, the jugular vein, here's the main jugular vein. I'm going to show pictures in different ways to represent this. There's a relative blockage at the base of the neck, and the blood has to find a way to recirculate. And in the process of recirculating and finding other ways, it may contribute to the inflammation that surrounds the plaque that I showed in that MRI slide previously, and may contribute to symptoms of MS.
The retrospective study examined outcomes for patients who had angioplasty and stents as needed for those narrowed veins.
99% of the patients that we've treated were discharged within 3 hours of receiving this minimally invasive therapy. That's a pretty impressive number. I'm going to talk about the minor complications that have been involved. Transient headache and neck discomfort, probably accounting for the most of that, and that's normal. When you expand a blood vessel, whether it be an artery or a vein, you are stretching it beyond what it was previously, its previous diameter from the day before or their entire lifespan before. They're going to feel that a bit. Now, most of that is self-limiting. Sometimes with a little over-the-counter medication that goes away. That's considered a very minor complication without further incident. Anytime you give patients X-ray dye for any procedure, there's always a risk of contrast allergy, just as if someone was having a CAT scan for any reason, abdominal pain. So there's always a risk of X-ray dye. We always get a history ahead of time, so we know and reduce that risk of complication as well if we know that was there. Transient abnormal heart rhythm is extremely uncommon. Like I was showing you the slide before, the conduit from the groin to the neck goes to the right side of the heart. So in someone who's younger, without any previous cardiac conditions, it's without incident, but it's even extremely rare in someone who already has a pre-existing condition. But the point there is that if we know that ahead of time, we can plan accordingly, get other specialists involved, either cardiology or at least have the procedure performed at the hospital as opposed to the office park where there's more amenities for treatment and such. The extended care or the more significant complications, vein injury from angioplasty, it's not impossible for that to happen, but it happens uncommonly. Sustained abnormal heart rhythm, again, just I was alluding to before, it's extremely uncommon. It can occur.
But being relatively safe doesn't answer the main question of whether it works. Anecdotal reports have suggested that the procedure relieves fatigue and other symptoms of MS, but confirmation in clinical trials will be crucial. Here at the SAR meeting in Chicago, I'm Crystal Fenn, MedPage Today.